Medical marijuana access and research. Probably one of the most controversial drugs to be legalized for medical use. I see a lack of education when people get so passionate about something like this. This currently is not like legalizing cocaine, for example. Let's take a look at current drugs and change our negative perception of medical marijuana. Vicodin, which once was a controlled third-level drug, or C3, by Uncle Sam, is now a C2 or control level 2 medication. Why? Because it is very addicting, and patients, once used to the drug, will complain of pain, not real pain, to get increases of dosing or a sooner prescription. Dilaudid. This drug is extremely addicting. Given a massive high, and it comes in different doses, it is a wonderful pain drug. Patients rave about its effectiveness, how well it works for managing pain and controlling pain. Because it is so highly addicting, it is often used short-term. Morphine. I think we are all familiar with morphine. This drug is also highly addicting, but it is also a wonder drug to stop and manage pain. It is used to ease the dying process for the chronically ill or aging patient. I can mention so many controlled substances which all manage one main thing: pain. That is what marijuana will be managing: pain, as well as other types of symptoms associated with chronic disease. Those chronic diseases are cancer, HIV and AIDS, hepatitis, as well as others. People have the misconception that some of these diseases are caused by drugs. Well, they are not. These blood-borne diseases are caused by transfer of human fluids or sharing needles to inject drugs such as heroin, but not by smoking marijuana and other drugs. Spit does not transfer disease. Neither does sweat. There are current campaigns and research centers advocating for the use of this drug. Research has shown to help decrease muscle spasms caused by multiple sclerosis, nausea from chemotherapy, and it helps increase appetite in the elderly and those individuals with HIV, AIDS, and cancer that suffer from poor appetites and weight decrease. Marijuana is looked as bad for your lungs for those who smoke it, but it can be taken in other forms such as vaporized, eaten, those infamous brownies that we see in many places, or it can be liquefied. There is no reason why medical marijuana cannot and should not be legalized in the United States. If you were a patient with any of these chronic conditions, I am sure that you would want to find something that's going to help you. Chemotherapy and radiation therapy are very harsh to the body. Medical marijuana can be taken in many different forms, and I believe it will be more useful in managing these pain and symptoms. See if you can agree with me.